Hi, welcome. This is Health Matters with me, Dishen Kumar, and today we are in Nexus, Bangsa South to talk about something you may already know about, breast cancer. Now, breast cancer is an issue in Malaysia and also in the world, and Health Matters has always been about perspectives. So today I will be bringing you two different perspectives. One is from a physician's point of view and another one is from a survivor of breast cancer. So join me in today's episode. This is Health Matters with me, Dishen Kumar. Today's topic, breast cancer. Today with me we have Dr. M. Devanan. Thank you, Doctor, for joining us today. Okay, now let's start off with a very general thing, I think, for anybody who's watching right now. What classifies as breast cancer?
Any change in the breast, basically, any change in the breast which is not normal. As much as we know, 90% of women will have some form of lumps in the breast at some stage of their life, either from the age of 12 to the age of old age. But when the lump starts to change character, by definition, it will more likely be a cancer. Okay. So while we see cancer as a non-entity in the past, but it has been there since Napoleon days, basically. In fact, Napoleon's sister also had breast cancer when she passed on at the age of 38. So the essence is cancer is about a change in the breast, and the cancer comes out at a point of time, always at the prime of our life.
So lumps in breast is normal?
Absolutely. 90% of lumps in the breast are completely harmless. Completely harmless. So we are always trying to encourage women that do not be afraid about the lumps that is present in the breast, because many a time they are truly harmless. So why fear a harmless lump? Just come, see a doctor, get an understanding. The most important part is about getting to understand what the lumps are all about.
Okay. Now, you have been in this line for a very, very long time.
Yes.
What is the current situation now in Malaysia and the world for breast cancer?
If we take simple statistics, we will not get complicated by statistics, but statistics guide us. Say, if you take from the WHO report of 2012, we had about 1.7 million new breast cancer cases, right? Of that, almost 400,000 are in Asia.
Wow.
And if you talk about Asia, almost like 185,000 in China, another 56,000 in Japan. We take the countries that are well developed versus again Indonesia, which has got about another 50,000 breast cancers. But the issues that strike us most basically is, whereas in China and Japan, the number of women who die of breast cancer is only about 25%, whereas in Indonesia, it's about almost 50%. Now, coming back to our country, in Malaysia, in 2012, WHO projected that we would have about 5,400 cases. We do not have an accurate sort of registry in the country, but nonetheless, those are coming in perspective. But as of last week, WHO projected, as in 2018, we were supposed to have at least 7,593 women with breast cancer. That is a steep increase of almost 50%. And that is very frightening, because that means whatever we have been doing, either through the process of Ministry of Health, through the process of NGOs, education, seminars, there are still a huge number of women with breast cancer. Now, what is striking about the cancer in Malaysia, and why the high death rate? Almost 42% of our women come in stage 3 and stage 4.
That's true.
So it goes to show that in spite of whatever the media is doing, in spite of the so-called high-tech iPhones that we have, the iPad, the computer, the so-called YouTube and so on and so forth, we still have women who are afraid to come out and present themselves for examination or early examination to detect breast cancer. So in Malaysia, we still have figures that is frightening, although the numbers may not be that high compared to the 40,000 cancers across, but breast cancer is #1 in female. So, and again, in this country, most cancers are seen below the age of 49. That means the young mothers. The young mothers.
All right. Now we have to talk about the cause for this. Now, you said that it's prevalent. People are getting it more. There's an increase of 50%, more than 50%.
Yes.
What causes breast cancer?
To be accurate, we do not know the cause. But across the board, we do know that 30% of cancers are known as a result of either because of alcohol. Age is one factor, basically. Whether it's got to do with diet, we still don't know. We have got 5 to 8% of women who have got family history of breast cancer. That means mother breast cancer, daughter breast cancer, and or the next of kin as in grandmother cancer. So that's a familial type breast cancer. Now, the others we don't know. Also, literally almost 70% of women who get breast cancer, we have no known factors. The small percentage is familial are the so-called BRCA1, the BRCA1 and BRCA2. Those are the genetics. But that requires a bit of blood test to identify.
Okay.
So 70% of those women who get breast cancer, we still don't know. So there may be some kind of genes that is obviously seen, not identified yet, as of today.
But isn't that very interesting? Not even very interesting, because there's a lot of questions, because medical terms and medical industry, the technology, there's a lot.
Absolutely.
But we still can't really find that cause.
Given that 70% of unknown factor, so it goes to show there's still some linkage between so-called diet, maybe in so-called the new modern diet, we're talking about the trans fats and so on and so forth. Lack of physical activity, yes. Obesity is a big crime now. We have got almost 49% of women who are obese, and when you're obese, premenopausal or after menopause, the risk of breast cancer increases. So we try and encourage women to identify these preventable factors like obesity, but it takes time. So obesity is the #1 factor, in fact, at this point of time, whether it is for breast or colorectal or even ovarian cancers, and those topics are being covered in today's forum. So the known factors are there, but it takes a journey for women to say, look, I'm at 848, I'm obese, I need to lose my weight. It takes years for them to lose their weight, and in that time, cancer creeps in.
Okay, and what about what type of cancer? Because breast cancer is not only one type. There's a few different things that we need to talk about.
Yeah.
So maybe we can talk about which type of cancer is severe and which type of cancer that can be treated, or maybe is there cancers that is not that serious as well?
No, cancer is cancer.
Okay.
The essence about cancer is about the stage that you present yourself in. So when we say in terms of staging, we see about almost 40% or 42% at stage 3 and stage 4. And in this country, 11% stage at stage 4. It means the cancer, it doesn't matter the pathological arena, it's about the staging.
Okay.
So when they come in at stage 4, survival rate is reduced to about 30, 10, 20%, 5 years. Stage 3 probably do about 60%, 5 years. What we are trying to see is, does a pathology correlate with the staging? The answer is yes. Most women, almost 70%, come in because infiltrating ductal carcinoma, the cancer that starts from within the milk ducts.
Okay.
Almost 70%.
So that's called ductal carcinoma.
Ductal carcinoma.
Okay.
Yes. Then we have got another 10% that come from lobules. So if we imagine the breast to be just like a tree, the trunk of the tree is a duct.
Okay.
The leaves are the lobules.
Okay.
And only 10% of cancer comes from the lobules. Unfortunately, the lobular carcinoma is very difficult to detect on mammogram. So you may have a breast which is full of cancer, but because it's coming in the leaves, we can't see the cancer, because the only way to detect cancer is either by a lump, which is imaginable. You can see a lump, yes, but you cannot define the lump. Whereas ductal carcinoma, you can see the trunk of the tree. You've got some calcium deposits inside that, and 70% you can make a diagnosis just by looking at a good mammogram. Then comes, we've got so-called 1%, 1%, 1% of the so-called the infrequent cancers, because one of them basically inflammatory breast cancer, which looks like infection, but truly very nasty cancer. That is rare. Across the board, the commonest is the infiltrating ductal carcinoma, which can be detected by a good mammogram. Of course, an ultrasound will help to define the lump.
Define, because it's quite interesting, you said a good mammogram.
Yes.
What do you mean by that?
We have got, in the past as many years, we were using the analog. Analog basically is a so-called generic version. And now we have got the digital format. Now, with the digital format, of course, not many hospitals will have that because it's an expensive machine. For screening purpose, you can use an analog machine just to look out at the tissue definition. But for accuracy and more sort of detail, you need to have the digital. So digital mammogram is just like your computer. You can shade it off, you can shade it off, you can brighten up, you can, so you can look at the grayscale and you can find even small tumors hidden within the tissue. So for screening, the analog is fine, but for diagnostic, digital. Now, we try and encourage young women, because we see a lot of breast cancer from the age of 40 to 49, young women, and the breast tissue is very dense. We advise them to do a digital mammogram because even though the tissue is dense, but the technology has now been able to provide where we can remove the density and still look inside the breast looking for the lump. So young women with dense breasts, advisable to have a digital mammogram.
Okay.
This is technology.
And talking about treatments, how does the treatment vary from, let's say you said stage 1 to stage 4?
Huge. Nowadays, stage 1 cancer can be as small as 5 millimeter. It can be 10 millimeter mm, and it can be even up to 20 mm stage 1, where the nodes are negative. That means the nodes are the one, the filter system that is in the armpit. So stage 1 basically is limited to cancer still within the breast, less than 20 mm, not involving the lymph nodes.
Okay.
But the moment lymph nodes get involved, or the cancer is beyond 20 mm, it becomes stage 2.
Okay.
And that is into stage 2A or 2B, whether nodes are involved or not involved. And of course, stage 3, when the cancer is more than 50 mm, nodes most likely to be involved. And stage 4, where the cancer is already spread across either the lungs, liver, bones, and even the brain.
Wow.
Stage 1 can be treated easily with just simple surgery. Of course, we advocate a bit of radiation to be done so that the chest wall is sterilized, and sometimes no chemotherapy. But if you have a young lady at the age of 35 with breast cancer, stage 1, it would be better for her to have chemotherapy.
Okay.
Right? Because we're still chasing after an aggressive disease for a young woman. The issue arises, there are also women who do not want to have chemotherapy because they are yet to have to go through pregnancy. They say, look, if you do chemotherapy, my ovary might shut down. So can you prevent that? I don't want my hair to lose, basically.
Because that is also quite another issue, where people are actually wondering, if I have breast cancer and I go for treatment, will it affect my fertility?
Absolutely. In all cases where we have go through chemotherapy and or some kind of hormone therapy, fertility will be affected to a degree or to even a bigger degree. So the issue arises from chemotherapy causing the ovary to shut down. If you're young, ovary may not shut down because ovary is still healthy. So you may get your periods back. Your fertility may improve, but all said and done, as you go through breast cancer, we don't advise you to get pregnant at least for the first 2 to 5 years as you go through treatment. But on the other hand, we have got today technology for stage 1 and stage 2. If your cancer is hormone sensitive, almost 70% of cancers are related to the hormones that you have within you. That means your estrogen and your progesterone. And they are the one causing the breast cancer. So question arises is, what makes this hormone become your enemy when it's supposed to be your friend? It's supposed to make your bone grow, your body grow, your hair grow, your beauty. It's got to do with estrogen. And you get into menopause when estrogen dries up, your skin dries up, your beauty goes down, your collagen level goes down. So there are now technology where we can assess and see whether if you are hormone sensitive, we can do new elements of tests where we can see whether you really need chemotherapy or you don't. And that is called Oncotype DX, which is an American. Otherwise, with those from Belgium, it's called Mama Print. Mama means breast. Print is a DNA technology. So you can print your DNA technology of your own cancer and see whether you have cancer, yes. Is it good cancer or is it bad cancer? Bad cancer, you've got no choice, chemotherapy. If you have good cancer, you have choice of not taking chemotherapy because the results dictate that if your cancer is good, your hormone tablet or anti-hormone tablet is enough. It's enough. But not for stage 3, but not stage 4.
Okay. So maybe we can go on to a very general view, your advice for people who should start doing mammograms and how often they should do it and things like that.
In perspective, mammogram is about looking into the breast, but because it involves a small dose of radiation, so the advocacy we started almost like 40 years ago is to do mammogram every 3 years, and we do that from the age of 40 because that's when we see women, or rather the graph for cancer starts to grow vertically up. And in this country, 40 to 49, we have almost like 30% of women with breast cancer. 30%. And if you reverse that and see what the American figures show, it's only 21%. So we have got a huge difference between 21% and 33%. It goes to show, is it that suddenly we as Asians have developed too fast? We are making a dietary change, even though it's cultural. We are making a huge change. Our nasi lemak now has become nasi lemak rendang, right? With a lot of stuff. Calorie value has gone up. So we talk about refined carbos rather than the fat, which was a prime blame. So the essence is things have changed. But the element here is, if that is the case, we want to say at 40, we define the mammogram from the age of 40. Even though some countries say 43, 46 and 49, then every year after the age of 50. But my advice, after having been through the industry for so many years and having young women with breast cancer, we advise women to do every 2 years.
Every 2 years?
Every 2 years from the age of 40.
From the age of 40?
40, yes.
Okay.
After the age of 50, if you have been screened through, you have no lumps, no suspicion, you can still do every 2 years, whereas Americans will record as every year. So I think from the Asian context, we should follow the Asian formula. What is common in all the 14 Asian countries? And there was a conference to discuss on this issue, that most breast cancer, almost 52%, are under the age of 49. It's only for the younger women at the age of 20, because we're already seeing breast cancer at the age 20, 30s, and a lot of young women, even at the age of 33, 34 with breast cancer. We encourage them to do ultrasound every 3 years or 2 years. If you've got a lump, every year. And if you have a family history, you must do ultrasound every year and you must do mammogram every year, even though you're below the age of 40. Because we are trying to see if there are any changes in the breast tissue taking place consequent to your genetic essence, whether you can see some calcification or otherwise. Of course, after the age of 50, what we have noticed in this Malaysian context, a lot of our women after the age of 50 don't come for mammogram. So my advocacy through the foundation and of course through the media is for the younger women who are attending our forum and all our seminars to talk to their mothers, their aunties, their grandmothers who are at home, not only in KL but beyond KL. Go to the center of hospitals, whether general hospitals or private, whatever it is, get a mammogram done, understand your baseline. If you're fine, you're fine. The idea is we are now seeing women at the age of 80s, 86 with breast cancer when the cancer is really stage 4. It's because we have neglected to take them for mammogram at an earlier stage.
All right. Hi, welcome back. This is Health Matters with me, Dishen Kumar, and today's topic is breast cancer. Now, earlier we talked to Dr. M. Deva Anand about the physician's perspective of the breast cancer issue, and with me now today, we are actually going to talk to a survivor of breast cancer. So, thank you, Puan Sri Manisi Adam, who is the patron for the Pink Wellness Foundation. Thank you, Puan Sri, for joining us today. We have to start off you being a breast cancer survivor. We have to talk about something that you went through, which is your reaction towards your diagnosis. What was going through your mind?
When I was diagnosed, before that, because I did a hysterectomy, which means I have to remove my uterus, everything, and because of the cyst, and my gynae at that time told me that I have to be on HRT, this hormone replacement therapy for life, because that protects me from getting heart attack. But so I do my mammogram every year, followed by ultrasound, because that is the sure thing that, you know, to detect whether there's any cancer cells or not. But for years I was on HRT, and for years I've been going on for my mammogram, for my checkup, but it was not detected. So I was happy at that time, you know, that every year is a clearing bill of health. So until I changed my gynae, and I changed also the hospital, which I did my mammogram, and there it was detected that there was some showings that it's suspicion, and I did my biopsy, and it was confirmed I was having cancer, breast cancer. So when the doctor told me that it's confirmed and it's positive, at that time my mind was turmoil, you know, that I didn't ask the question, why me, because it can happen to anybody. At that time I was 68 years old, and I thought I would be enjoying life, things like that, you know. So when that happens, I have to take stock of my life, and I told my husband that if this is fate, we have to face it. We have to be positive, and you have to go through whatever that you know, necessary for me to get well. Because I was looking for a support group that to give me the support, to a shoulder to cry, or a hand, you know, to this thing, to hold and give you that courage, encouragement. Yeah, there were a few, but the sessions that we go through, I did attend few sessions. It's all crying sessions. You know, it's only you pour out, you know, what you went through, and you start crying. Everybody in the hall start crying. I said, this is not me. I said, you know, you are patient. You have to be strong. Because when you start crying, your system goes down. So
Morale goes down.
Yeah, everything goes down. Your brain works differently, your body differently, and you leave the hall feeling bad, you know, because somebody related the story, things like that, you know, husband tinggal lah, you know, things like that, very sad stories.
There's a lot of negativity.
Yeah. So it's sad. So I said no. So until I was approached by Dr. Dave, who already done the foundation, and asked me to become the patron. So I straight away say yes. This is what I want to do. The awareness is very poor, and especially the town. I went to Terengganu recently in Kuantan. They say among the educated women, they are afraid to go for mammogram. See, there's nothing. Mammogram is just the pain is very, very minimal, and it's very short time. It doesn't take you long, and it's good for you.
Can surround yourself.
Don't be mixing with negative friends. No, if they are negative, just smile and walk away. You know. And don't argue, because it's bad for you, for your brain, things like that. Singing and dancing is good. So life is treating me well. Alhamdulillah, yes.
All right. Thank you so much for your time. Now, thank you for watching. This has been Health Matters with me, Dishen Kumar. And today's episode and topic was breast cancer. Now, breast cancer is very prevalent in this country. I believe every one of us has dealt with this disease before, maybe through a family member or through a friend. Now, what I can take away from this episode is the numbers of breast cancer cases are increasing and the age gap is actually decreasing. So what we can actually do is actually take care of our life. I know maintaining a healthy lifestyle is not easy, but that is something that we should do. Now, prevention is always better than cure, so please go to your doctors and also get mammograms and also ultrasounds according to what age you are and also whether do you have a family history in this breast cancer. Now, I hope you enjoyed this episode. My name is Dishen Kumar. I'll see you in the next episode. Goodbye.